Hello and welcome to webinar series. Myself Shanti, and today's very hot topic which we are going to discuss about is on all about on heat exhaustion and how one should recognize and manage for the same. Yes, as heat is upon us, and with the extreme rise of temperature across the region, heat exhaustion has become a critical and must discussion topic. For this discussion, now I welcome Dr. Vignesh Naidu ji, who is our senior consultant, general medicine from Yashoda Hospital, Secunderabad unit. I welcome you, Dr. Vignesh.
Thank you, boss.
And I also request all the speakers to introduce yourself. Yes, over to you, Madhu.
Hi all, it is a pleasure to be part of this webinar today. Myself Madhunisha, I'm working as a senior assistant nurse, elderly care in Sweden. Thank you for this joining with us, sir. Thank you for giving this opportunity, Mrs. Shanti ma'am.
Yes, thank you, Madhu. I welcome you as well. Yes, Shushmita.
Hello everyone. This is Shushmita Christina working as senior staff nurse at NIMS Hospital, Panchagutta. First of all, I would be thankful to Shanti ma'am for giving this opportunity. Thank you.
So yes, let us see what we have in the rest of the discussion. As expertise is none other Dr. Vignesh ji, and I'm sure he must be receiving a lot of these patients in his OPD. And before logging to the webinar, I wanted to ask him whether what is your experience for this season now, and also would like to ask, because I'm just going through the IMD telecast for the same. Like, is India experiencing heat crisis? Because we have seen even little telecast on Mumbai's hospital scenario, where a lot of casualties were seen in the hospitals with heat related illness. Over to you for your insight. Yeah. Yes, over to you, Dr. Vignesh.
Yes, please. So what we basically have noticed in the recent past is it basically affects more on the elderly population, especially in terms of heat exhaustion syndrome. Heat stroke can come across anybody, in fact, at any given age. It could be pediatric, it could be regular healthy adults also. So when they're not accustomed to being exposed to protracted hours of heat or harsh sunlight exposure, that can make them more prone to develop these heat symptoms. And if especially if they are dehydrated or not well hydrated, they can further complicate these matters. So as you have seen, there is definitely a heat crisis. IMD has been predicting that the temperatures are bound to go up. Even in Hyderabad, I believe over the next 1 week or so, Telugu states that there's a high probability of the temperatures crossing 43 to 45 degrees is what I've seen yesterday. So yes, we have to be prepared for it. And no, many people are not prepared because they still carry on their lifestyles on a day-to-day basis. So they're not sufficiently hydrated to cope with this extreme heat, and they're not taking enough amount of precautions to ensure that they're protected from the heat, either direct or indirect.
Yes. So yes, so that was interesting update on the same, and let us see what we have in the rest of the discussion. Yes, so over to you, Madhu. Yes.
Thanks for your product input, sir. As you said that combined with inadequate fluid intake occurs due to prolonged exposure of high temperature. My question is, what is the really heat exhaustion, sir?
In very simple terms, sir, because there are a lot of dynamics of heat stress, like exhaustion, heat stress, and heat exhaustion. Because I think I was also experiencing heat exhaustion yesterday, though I was indoor. So, in simple terms, because the viewers and audiences are all nurses, so in very simple term, what is actually heat exhaustion means? Over to you.
So you basically end up feeling extremely tired, weak. You feel that you don't have sufficient amount of energy to do things. You might have headaches sometimes, you might feel dehydrated, you feel very listless and tired, and most of them complain of feeling extremely uneasy. So these are the very vague things that you can go about and say that yes, this person could have heat exhaustion or heat stroke, especially if they are dehydrated or have been exposed suddenly to a large amount of or protracted duration of harsh sunlight or heat.
Yes, yes. Yes, further, over to you, Sushmita.
Thank you for the information, sir. Actually, I want to know about what is the heat stress is a broader term, and how do they progress, sir?
What is the heat?
Like, it is a broader term. How do these condition progress from the gradual start to the, yes.
See, initially, how your body responds to heat is by trying to cool itself down by ensuring that your body sweats sufficiently and cools the external temperature. But
Yes.
when your body is overwhelmed, the body's ability to cool itself comes down. So you will, when the patient comes down with a heat stroke or heat exhaustion, the first thing that you notice is they're not sweating. The skin is warm and clammy and relatively dry. The second thing that you can look for is how the tongue is and how the skin turgor is. When there's no shiny salivary layer over the tongue, or the lips are dry, or the skin turgor is lost or delayed, then you can get about and say that they're dehydrated and there's probable chance of having heat exhaustion. Now, what you have to check apart from these clinical symptoms is the temperature of the body. So when you look at it, normally the temperatures ranges in the hyperparexic range. That is, the core temperature is very much on the higher side.
Yes,
And
yes.
despite giving PCM like how normally a first aid person might assume and give, you will not
Yes.
notice a sweating bout after giving paracetamol in a person with heat exhaustion syndrome or heat stroke. So
Yes.
one of the important things that you should do is that you should sufficiently allow the skin to breathe. They should be exposed to as much as cold environ as possible.
Yes.
And they should be wearing simple loose cotton clothing, or if they're wearing something else, ensure that they're just covered with a thin wet sheet or a bed sheet or a cotton sheet, so that that reduces your core body temperature to what extent it can.
Yes, yes. And generally, when it comes to our mind, we always think, when a person exposes to the extreme heat, maybe the person sweats very badly. But yes, as you rightly said, and thanks for clearing the myth. Yes. Yes. Oh, what do you?
It is an
Yeah,
interesting
madam.
update.
Yes.
As of the core body temperature reaches 104 degrees Fahrenheit. Sir, what is the process of heat transfer in extreme condition?
See, what you
Like
need to do
mechanism
is,
of this process of heat transfer, how? Like in simple term, yes.
see, your body is supposed to sweat and reduce the temperature of the core. But when sweat evaporates at a much higher, faster rate than what your body can produce, the body is being irradiated with extreme amount of radiation, because of which your convection increases and evaporation has already stopped doing it. So your core
Yes,
body
yes,
temperature reaches beyond a point. And when
yes,
your temperature crosses 104, your internal function of the organs also start getting affected,
yes,
including your brain function. That's when you
yes,
find people starting to faint, presenting with a semi-delirious or a semi-comatose or an altered sensorium to your emergency rooms. It's all because of your body becoming overwhelmed and the inability of the body to dissipate the heat that it is taking in.
yes, yes. And this is a very important slide. I think, yes, Sushmita, would you like to take over for this thing? Yeah.
Yes, ma'am. Thank you for the information, sir. My next question is, if a person is suffering with affected with heat exhaustion, they will be having symptoms like headache, vomiting, and dizziness, and they will be feeling like severe thirstiness. So,
Yes.
actually, how we can recognize that heat exhaustion, sir? Could you please tell me?
That's exactly what I'm saying. Their patients, one, they'll come if they are conscious and coherent, they will tell you they feel extremely tired, extremely fatigued, extremely
Yes,
dehydrated, extremely thirsty. But despite taking measures to hydrate themselves, they're still not doing good. They will not clinically improve and the temperature doesn't start going down. All
yes,
right, now if the patient presents with an altered state of centurium, what you will notice is the skin is cold and calm. You will not find your core temperature on the higher side. You will feel it is clammy. It is not sweaty, but it is clammy.
climate.
Your blood pressure will be on the lower side, or if you look at the peripheral pulses, the volume in nature will be on the lower side.
Yes,
Because of dehydration, they might have symptoms like headache. Because of dehydration, they might have an altered state of centurium. Nausea and vomiting is normally associated with this kind of symptoms. Temperature, core body temperature, like we have discussed, is be very much on the higher side, and your heart rate will also be on the higher side. And like I said, to understand whether you're hydrated or dehydrated, the tongue, your dryness of your lips, and loss of skin turgor tells you, and along with
yes,
your blood pressure and your pulse rate tells you whether there's chances of dehydration occurring along with the heat
yes.
exhaustion.
Yes. So I wanted to ask you, like, are you receiving such cases who is walking into your OPD, maybe as a daycare or as a,
Yes,
IP?
elderly,
Like,
elderly people, especially diabetics, People with
Yes.
thyroid issues and cardiac issues are the people we see most often who are intolerant or incapable of handling such kind of sudden rise in temperatures.
Yes.
And since diabetic patients are also sometimes on diuretics, it complicates the dehydration process a little bit more. So it's a fine balance. But yes, we see in among
Yes.
elderly people or people with comorbidities.
Yes. And they are the majority of the high risk groups. Yes.
Yes.
Yes, Madhu. Madhu, are you there? Okay, maybe there's a problem there. Yeah. So I was just understanding, like, is heat cramps considered as a first and early warning signs? Like, maybe very generally, heat cramps everybody experiences sometimes when we start for the long time as well. But
Yes.
then in this case, because a lot of the time overheated and dehydration causes a lot of salts to be lost from the body.
Yes.
So what is your take on the same, sir? Yeah.
See, normally cramps do tend to occur more so during the winter seasons. But if you start experiencing muscle cramps during summer seasons,
Yes.
even among athletes per se, it basically
Yes.
means that you're losing out on salts. There is an occurring or an increasing electrolyte imbalance which is occurring. So just by hydrating yourself with plain water, it is not going to be sufficient. You should ensure that your salts are being replaced. So the moment you increase your salt consumption along with water, along with your food or basic electrolyte supplementation, you notice that your cramps are actually coming down. So if you notice that you have a symptomatic improvement on taking salts, it is more to do with electrolyte loss because of heat exhaustion.
And how do we manage these, kind of like elderly who is hypertensive, and the salt is consuming salt is a contraindicated factor for them. So what
No,
is your advice for them?
we never say no to salt at any given point of
Yes.
time. We only try to
Okay.
restrict
Okay.
the amount of salt they are taking in. So
Yes.
because losing excess amount of salt, replacing the salt which is being lost is not a contraindication at all.
No.
They can most
Yes.
welcome with it. They need to keep a regular check on the blood pressure levels, how they are, and look if there's developing any sort of edema or anything of that sort. So as long as they are closely in touch with the physicians or the cardiologists, I think they can be managed perfectly.
Yes, yeah, greatly. As the thanks for clearing this doubt as well. Yes. So now, after having dealt this kind of scenario, now what are the immediate first aid response we should be providing somebody who is a man trying to manage this condition at home? I try to jotted few things, like as you were saying, clothing should be light and little wet, clothing should be worn. All this, yes, over to you.
Irrespective of how we
Few
feel, whether we are
parameters.
thirsty or not, yes, you have to keep taking oral hydration at a regular interval. Every
Yes.
hourly sips of water or added pinch and salt water or buttermilk or your coconut water, tender coconut water, anything which
Yes.
has got hydrating levels and anything which improves the chance of absorption of the fluid has to be consumed on a regular interval, irrespective of how we feel, especially among elderly people during the hot summer seasons. All right.
Yes.
Clothing comes, yes, you should wear light colored clothing, should not refrain from wearing dark colored ones because they absorb heat at a much faster rate. Sticking to simple cotton clothing or linen clothing is always preferred when compared to synthetic materials because this allows the skin to breathe and allows the air to go in and out and helps dissipate the body temperature better. Also, synthetic ones tend to retain the temperature inside, so they tend to become dehydrated or go into an exhaustion at a much faster level. And it's always preferable they remain in a cool place rather than staying on the upper floors of the house. If they tend to stay on the lower floors where the temperature is relatively lower, it is much,
Yes.
much better. It should be well ventilated. These are the
Yes.
things that you can normally do.
And even I was trying to understand little few very easy tips. Anyways, you've been giving a lot of tips, but yeah, when it comes to the hydration, because sometimes when we are indoor, also we bound to forget hydration intake. Like the challenges which outdoor employees like field workers and some marketing fellows, what they experience is again far more challengeable.
Mm.
So what are the little few tips you would like to give? Like pre-hydration is more important before we come to work, because during work we about to forget things. So yeah, even
Yes.
consuming water rich fruits and all few natural ways of electrolytes also we were just going through. So yeah, little few tips, and then yeah.
Just a pinch of salt, a pinch of sugar in your regular water itself will help re-establish your electrolyte imbalance. You can take tender coconut water or buttermilk. They tend to keep you well hydrated. You can take citric fruit items like musambi, what you get, or lemon, sweet lemon, or oranges, or lime water, also for that matter, because many people find drinking plain water unpalatable. That with a pinch of salt will do the job. High fiber, high hydrated fruits like watermelon, muskmelon, grapes also tend to nicely hydrate your body, and they tend to keep you full for a slightly longer duration of time. So you can definitely have that kind of stuff also.
Yes. Yes, I think we have just come to the nearing of the slide of the discussion. Yes, Sushmita, over to you.
Yes, sir. Thank you for the information, sir. I just want to know about hypovolemic shock, sir, as it is a highly fatal, and it is if it is not treated, the person may die also. So can
True.
you please explain it in detail, sir?
See, basically what happens is when the person is extremely dehydrated, the volume of the blood comes down. Blood becomes thicker, and the blood circulatory system has to now go on a overdrive to kind of push what is there. When the blood
Yes.
pressure becomes too low, the input to the heart comes down. So the output from the heart also starts coming down. When there's sufficiently organ perfusion does not tend to occur, you start noticing that people start becoming drowsy, stuporous, altered sensorium, internal organ damages. Kidney especially can get affected severely in many such people. Cardiac function can also be impaired. So that is why we say that the moment we receive them, the first thing that we do is hydrate them sufficiently. Of course, provided they don't have any preceding cardiac events. In such a case, we should always have a screening echo, and basis on the ejection fraction, the rate of fluid correction has to be carefully monitored. But the first and foremost thing is we normally tend to keep them in a much cooler place where we try to reduce the core body temperature externally also. Internally also, sometimes you can reduce the core body temperature by passing a riles and passing frozen or cold NS into the stomach, so that from the core temperature also starts coming down. And IV fluids, of course, play a very important role. Ice baths have been done in the past, but they're not practically possible every given way. The easiest thing you can do is to drench a sheet and put the sheet across a otherwise derobed patient, and ensure that you're having a fan blown directly at that or under the AC vent. So that reduces the external core body temperature faster.
Yes. So that was very interesting insight provided by you. And yes, we always said we will be keeping our session time bound. And thank you so much for your valuable time and participant. Also, I'm thanking everybody. And I urge all the viewers to just refer our website, which is www.yashodahospitals.com, for more health academic updates, podcast, short reels, and also patient testimonials, because all our clinicians are, they like this last 2 days ago only we have celebrated the National International Health Day. Yeah, it is to join the cause so that health education is disseminated to everybody, and then we can prevent a lot of diseases. Yes. Yeah, thank you, Dr. Vignesh, and thank you, Madhu, and thank you, Sushmita. That was really wonderful, and we end the session. Thank you.